All right, good afternoon, everyone. Thank you so much for joining us for our second session today. With us, we have Alvina Chu, and she is from the Florida Department of Health in Orange County. And today she'll be talking about her experiences working for a state department, as well as some of the things that you could be looking forward to and what you might be able to expect. So with that, Alvina.
Oh, thank you. Thanks. I just wanted to start with a little bit of video, so I wasn't a random voice talking to you over the computer, but I'll pull up some slides. I don't know if you want to put it in the chat, but just a couple of questions just to get a sense of who you all are. So, you know, where you're from, where you maybe where you hope to land. You know, if anyone's looking to come down to Florida, I've got some job openings. I can email you later. But let me start with some slides. So. Can everyone see the slides all right? Wait, let me see. Hit the share button and then it should be up.
Yes, we can see them now.
Okay, great. Thanks. So I just wanted to give you some insights on my experience. So I've worked at actually both state and local health departments. Currently, I'm at the Florida Department of Health in Orange County. And I'll go more into my personal experience in a little bit, but I just wanted to set the stage a little bit for, you know, state civil service or government work, as we call it. And if you'll indulge me, I have a little question for you. And if you'd like to chat it, write it, or maybe if anyone wants to take a guess, we can unmute your mic for where in the US Constitution is public health, where is the authority for public health described to in the US Constitution? If anyone knows. And I'll just give it a second. Sorry, and now I'm trying to advance and it's not working with me. So we'll just say nowhere. So public health per se is not specifically listed as an authority for the federal government. And I want you to keep this a little bit in the back of your mind as we go through some of the, you know, the roles and responsibilities of state and local health departments and where their authorities lie. So the power is not delegated to the US or the federal government by the US Constitution, nor prohibited by it to the states, are reserved to the states. And what this means in our world is in the United States, the primary authority for public health surveillance generally belongs to state governments. And so all the public health investigations, the outbreak investigations, the, you know, a hot topic these days. So vaccine mandates or other authorities, all those public health authorities lie with state governments. And so tuck that into the back of your mind. And so what do epidemiologists do in these realms? And what I have here is the Bureau of Labor Statistics. These are some definitions about what epidemiologists do, and you may have had either heard of these or read these before, but you know, very generically, study public health problems, collect and analyze information from direct observation or from data collected from others, communicate these findings to public health or to health practitioners, policymakers, and the public. And so this is the creation of the guidances that we follow in the general public, and also the regulations that are created by each state for public health reporting by healthcare providers and also by laboratories. So the conducting of surveillance, also managing programs through planning, monitoring progress, and quality improvement, of course, and then the ever important running grant proposals to fund research. So these kinds of activities are very broad and can be conducted by epidemiologists at state and local governments in various departments. You know, so a little bit about me is, I believe Olivia let you know that I'm the director of the Infectious Diseases Division here at the Florida Department of Health in Orange County, and so my focus has, in my career, has generally been on infectious diseases. And so where do we work? We typically work in applied public health. We do applied public health or research. So at state and local governments, this is generally, you can work for a county government. So every state, based on the information I told you before about how public health authority lies with state governments, within every state, the public health system varies. And so the structures can be very different. Currently, I work at the Orange County Health Department, which is what we used to be called, but I'm a state employee. And so essentially we're like mini state health departments set up in every county. It's different in other states. So in other states, your county health department might be a function of county government and not of state government. Also, the structure can be different. Reporting structures can be different. So as far as integration, so there might be, satellite offices in regions, depending on how large the state is. Say Texas has many layers to go from county to state government, versus someplace that is very small, such as like Delaware, has essentially one health department that covers 3 counties. So and we generally refer to ourselves working in the state and local governments as applied epidemiologists, applied public health epidemiologists versus research epidemiologists, who typically work for places like federal agencies, like the NIH or the CDC. So as I'd set up in the background, so the CDC is not necessarily like a federal public health agency. It's they provide technical assistance or technical guidance, and they serve as the reference lab, and they serve as the basic science references for states. And so the next several slides are going to be a couple of statistics from the Bureau of Labor Statistics, just to show you basically where do epidemiologists work based on the labor statistics classification, which was one of the first bullets that I set up before. And so pretty much over half of epidemiologists work in state or local governments. And this is, I think, primarily illustrated by the public health authorities, which we described, which goes to local governments, state and local versus federal. And state governments are the, I guess, highest volume of employers. State and local governments, we are the highest volume of employers for epidemiologists. And then after that, hospitals, and then scientific research and development services, and then colleges and universities, such as Hopkins. And by comparison, you're getting ready to, if you're getting ready to look at a career in state or local government or civil service, I think probably anecdotally, you probably have heard, who are the top paying industries for epidemiologists? Well, certainly not the top 5 as apparent on the slide. So while state and local governments employ the largest number of epidemiologists, they are not the top paying industries for epidemiologists. And so those are, as you can imagine, private industries and private industries and the universities and academic research centers. Just to give you a sense of the wages across the United States, just geographically, and this sort of falls a little bit along the same, if you were to look at all jobs across all classifications or all types of jobs, his wages are lower, generally lower in the Southeast area and higher in the Northeast area. And just to give sort of an outlook, just a snapshot about what we expect. So the next topic I was going to sort of move into is what is the landscape? What does the job or the workforce landscape look like for epidemiologists in the upcoming years? What do we expect? So the median pay across all geographic areas, and this will vary widely based on what you saw on the previous slide about the geographic distribution, somewhere around $75,000 per year. So median pay about $35 per hour. Most places expect when they hire an epidemiologist that they will have a master's in public health or some kind of related field. Most places will take little to no experience in applied public health, depending on the level that you're applying for. But for entry level jobs, little to no experience. So the master's degree is sort of expected to have given you a good basis for entry into applied epidemiology work. And the job outlook for the next 10 years from the Bureau is that we are increasing. So there's a 30%, there's expected to be a 30% increase in the amount of jobs for epidemiologists coming up over the next 10 years. And the question about state and local working in public versus private. And so we did touch upon this in a couple of slides about who are the top paying industries. And so on average, even for all other jobs, not just epidemiology jobs, but in general, governments pay, or public service pays less than private industry. And it won't be all doom and gloom, but I just wanted to, set up the stage for expectations. Don't want to have any mismatched expectations. I did want to tell you a little bit about a study conducted by the Council of State and Territorial Epidemiologists, or CSTE, which is, there's two major professional organizations for applied public health EPIs, and that's CSTE. They are the body that helps decide, national standards for case definitions, also national standards for reporting and surveillance. The other professional organization is NACCHO, so the National Association of County and City Health Officers. And so these two organizations primarily focus on work that's conducted in the public sector at the state and local levels. So periodically, so every several years, CSD conducts an epidemiology capacity assessment across the US and by state to sort of help states plan for and build workforce capacity. So they give us a picture about the number of jobs or what the need is in every state versus what every state has. And so it helps our efforts in trying to increase the EPI workforce at the public level. So since 2017, infectious diseases, chronic disease, and maternal and child health has experienced a decrease, partly funding decreases nationwide. Currently, the applied EPI workforce, as in this 2021 study or assessment that they recently did, is concentrated primarily in the COVID-19 response and infectious diseases. And as demonstrated by the previous slides, historically, salary increases do not necessarily keep up with the inflation rate from the last several years. And state and local governments do struggle to be competitive, in the markets. So based on the median, I think I showed you previously, the median salary that's expected nationwide for a master's level epidemiologist was about $35 an hour. I can tell you in my own health department, a master's level EPI makes $25 an hour. And so being in the South, and being in government, it's hard to be competitive. But there is a great need. We rely heavily on federal funding to continue our activities. And we hope to sort of help bolster the workforce through additional training and more opportunities in like hands-on applied EPI. So I poached this meme from the internet, which you might have seen before if you are, if you trawl some of the discussion boards or some of the EPI websites. So what other people think we do versus what we actually do. And so all of these perceptions I have encountered throughout my career, as you may, when you might have told people that you were working on a master's degree in public health or in epidemiology. So the last box for what I actually do is kind of not what I ever thought I would be doing, which is One of the points of what activities do epidemiologists do, one of them is convey public information to the general public. So in my most recently during this pandemic, I've conducted more press conferences in the last several months than I ever thought I would in my entire lifetime. So I've asked a couple of epidemiologists in my offices, basically what was their day like today? And this was probably about, this was just before Christmas, so on December 23rd. So I asked everyone, what was their day? What did they work on today? And just to give you a sense of at a county health department or at a local health department, what do we do? Like, what do we actually do? Because one can say in a job description, say data analysis, case investigations, follow up with patients, that kind of thing. But what does it actually look like? So during this pandemic, the state authorities, the state has the authority for public health. And so we have to incorporate, say, CDC or federal guidance into what we are actually going to do on the ground within our own state. So I'm in Florida, and maybe if you follow the news, you know that there are several locations that have personalized guidance for each of their states. And so we have to adapt that and then be able to convey it to the general public in a meaningful and understandable way. So on this particular day, we investigated 4 hepatitis A cases, 1 in a food service worker, which is a big deal. If there's not a whole lot of hepatitis A in the United States since vaccine came about in the 1990s. And since it's been a requirement for school entry. And Hep A, since it's fecal oral, Hep A in a food service worker is a big deal because you don't want an outbreak, a foodborne outbreak, to go through food service. Potentially with dengue, a possible dengue positive patient, which in Florida is a big deal because if dengue's mosquito borne, and if it establishes itself locally in Florida, we have a problem. So we do not have endemic dengue in Florida. It's a pandemic still. And so we did issue a federal do not board order for a COVID-19 positive traveler at an airport. There's a lot of rabies. There's because it's the South, it's Florida, it's outdoors, it's warm, it's 80 degrees right now, not to rub it in or anything. There's a lot of people outside interacting with wildlife. And so we do investigate a lot of reports of human and wild animal interactions or encounters and then follow up with prophylaxis for rabies. And then our bread and butter kind of infectious diseases, cases of hepatitis B and C, salmonella. Florida has one of the highest incidences of salmonella in the United States. I think we're in the top 3. Carbon monoxide is reportable in the state of Florida, but not in every state. And so we do follow up on those. Rule out West Nile. Let's see, and investigate lead poisoning. We work with our mosquito control board to try to contain potential exposures to mosquitoes, honestly, from people who might have things like dengue or West Nile virus. And then some data cleaning for provider addresses. We're working with our community health group to try to identify health deserts. So those areas where there might be disparities and lack of access to medical care. And so some data things too. And so how did I get here to this place? And so I just poached this from LinkedIn because they have a nice visual layout. So I am class of 98. I got my MHS from Hopkins, from Bloomberg. It wasn't called Bloomberg when I was there, but it's Bloomberg now. And I did my graduate and my undergrad there. And I'm originally from Florida. I'm a product of public schools. And I left home to go to college and grad school. And then my first job was at Hopkins at the School of Public Health. In the Department of Molecular Microbiology and Immunology, under Greg Glass, studying Lyme disease and all sorts of vector-borne diseases. So also working with, I don't know if he's still there, Dr. Schiff on schistosomiasis, Dr. Markham on HIV. So my first job was actually, kind of the easy segue. I went from being a student and then working for my faculty advisor. And so I think that was sort of a good break-in experience for me. And then there was 9/11. So I remember, a lot of you probably might be too young, but I remember when I heard the news about 9/11, and I don't know if there are others who might want to share their experience, but I was on my way to work at Hopkins, driving in on Wolf Street, and I heard it on the radio. And so I don't know if you've been around long enough to see this sort of phenomenon where after there's like a large crisis or large emergency response that might be needed, there's a lot of resources that are sort of thrown in that direction. And so in the post 9/11 days and in the post anthrax days, so in October, there were the anthrax letters that were mailed out and several public health investigations that occurred because of that. And then a lot of federal resources granted to states to try to build up emergency response and preparedness. And so in just after the anthrax events, I started looking for jobs at the state and local health departments. And so there was a newly formed division, the Office of Preparedness and Response, at the state health department. And so I went over there to be a bioterrorism surveillance epidemiologist. And at 25, that was really exciting. And it was a new field, sort of a burgeoning field, and it was a new division. So there were a lot of growing pains, but it was a good experience. Eventually became the Strategic National Stockpile Coordinator, which was working with local health departments to create plans to distribute vaccines and antibiotic prophylaxis in the event of a bioterrorism event. I also conducted bioterrorism surveillance and worked on with a JHU applied physics lab to develop a syndromic surveillance system called Essence, which is now currently used in many states across the United States. And then I was the chief of the Division of Outbreak Investigation for the state of Maryland for about 10 years, which was really one of the, probably like one of the best jobs I ever had. I didn't have a whole lot of administrative responsibilities at that point, and pretty much my job was to investigate infectious disease outbreaks, manage, control them, and prevent them. And so that so far has been the bulk of where I spent my career. And I think there was some invaluable experience we had there. And so currently I moved back down to Florida to be closer to mom and dad. And so in 2017, I came down to the Orange County Health Department to be the epidemiology program manager, which is going from state to local is a different kind of experience. So, at the state health department, you're trying to create guidance that could be used consistently across all jurisdictions within your state. And then at the local health department, you're receiving this guidance, and then you're the ones that are trying to figure out how exactly do I do this, how does this person get from one place to another? How do I get their lab specimens? It's a very, it's interesting and fun in a different way, very much hands-on. So I was here for a little over a year, maybe a year and a half. And then the call of if you recall, private industry pays more than public industry. And so in October 2019, I left the county health department here to become an infection preventionist at one of the local health systems here in Orlando. And I got how much was it? 30% pay increase, which I enjoyed, but the work was different. So I'll tell you, so there are many epidemiologists. So I think if you go back to some of the previous slides, hospitals and physicians' offices are two of the largest, two also of the highest paying employers for epidemiologists. And so in a hospital setting, I was an infection preventionist providing guidance about how to control infections in a very specific setting, which was the acute care setting. And then the pandemic came. And so I think I felt like my years of experience in applied public health and in the public sector would be best served by my going back to public health. And so I came back. And so I've been here ever since, working on the pandemic at the local level. So essentially it was the call of, it's a little bit, if you're an infectious disease epidemiologist, it's kind of a once in a lifetime kind of experience. And there are currently a lot of resources that are being distributed to local and state governments to work on this epidemic and respond. So that's essentially in a nutshell how I got here. And so how do you get here? And so I had mentioned that I started looking for, when I was in Maryland, I started looking for a job at the state and local health departments. And it's not always, I'm going to use Maryland and Florida as my two examples as far as trying to find a job in government. So I went onto the state of Maryland website where they post all their job openings. And there's a epidemiologist 3 job opening getting posted, that's posted currently. So that part was just a keyword search and it's fairly easy. If you go to the state of Florida website, these I know are jobs for epidemiologists in local health departments, but the government classification for an epidemiologist is not epidemiologist. And so I guess there's this one point I wanted to bring up to you about if you're going to be out there looking for a job to try to, the word epidemiologist is not necessarily built into a lot of job classification systems. So you really have to look into what the job actually entails, maybe seek out some people you might network with to find out what their job classification is if they work in a state or local government where you want to get a job, and find out what classifications do EPIs go into. Because in my own health department here, I have people doing the work of an epidemiologist who are classified as biological scientists and government operations analysts and government operations consultants. And so it's varied as to what one might actually be classified as or what the job might be posted as, and it's not often or doesn't necessarily have to be the word epidemiologist. So typically most places will require a master's degree in public health or some kind of related field, but they really can vary. So biostatistics, coursework in epidemiology, biological sciences, particularly important if you're going to go into something like infectious diseases. Here where I am, I try to hire people who have a background in biology because understanding the basics, the biological basis of the pathogens is important in informing, public health recommendations based on incubation periods and then viral shedding and that kind of thing. Also interpretation of medical labs and how that applies to case definition, I find is incredibly useful if you're going to go into infectious diseases. But there might be some other focuses, say like in chronic disease has a different focus. People who work in like health disparities or in other places looking more at demographics, or there might be more focus on math and statistics as a background. And there are many places who employ epidemiologists that have degrees in say master's and MP and medical degrees. So medical epidemiologists, those are generally can be your state epidemiologist or state health officers or county health officers. And mostly what I'm looking for is a person who can communicate well, on a on a professional level, so talking to medical professionals, but then also being able to distill difficult information into understandable pieces for the general public, because that would be one part of our job, would be to be able to convey this information to the general public for the holy grail of public health, which is behavior change. So critical thinking skills, specifically looking for persons who are able to absorb the guidance that is given and then be able to apply it, or the principles of that guidance, into various scenarios, because nothing's ever static in acute infectious diseases. So you work on a, say, measles case at one time, and then the scenario will have multiple permutations the next time you work on it. And so you'll need to be able to take the guidance, use the principles that you used for the first one, and then apply it appropriately, the principles to investigate and control the second case, which requires a lot of attention to detail. And also looking for leadership skills, which goes along with the communication skills, which is not only conveying the information to people, but also to be able to essentially convince them in some way, or to lead a group towards a certain goal to be during an investigation, for example. And then math and statistical skills. So to be able to understand what is the difference between endemic and epidemic, and how might one quantify that in some way. And then I just wanted to bring up a little bit about some training opportunities. So so you don't necessarily, if you're looking to get into work in the state and local government, you don't necessarily have to go straight into a job. There are some training programs and also some fellowships which might be interesting to you. And actually, top of the list, or the most famous, or is the CDC Epidemic Intelligence Service. And so the CDC has a 2-year training program where they place medical professionals or doctoral degree, or persons with doctoral degrees or other clinical degrees plus an MPH into state health departments or at CDC for a 2-year training. I believe one of our former U.S. Surgeon Generals, probably more than one, but alumni of EIS end up generally in some fairly high places. So U.S. Surgeon General, the head of the American Public Health Association, several state epidemiologists, the current one in Maryland, for sure. There's also the CST Applied Epidemiology Fellowship, which I believe is also a 2-year program for post-MPH or postmaster's students, which is, as I mentioned, CST is the Council of State and Territorial Epidemiologists. And so these fellowship students are placed into state health departments for a 2-year training program. And then more science-based would be at the FDA. And then also, of course, NIH postdoctoral fellowships are available. So that's essentially what I had in a nutshell. And so I just wanted to open up for any questions. I'll stop sharing so that we can have a conversation. I think I might have missed the chat questions while I was talking, since I had the screen share. So for Sarah's question, do all local and government public health jobs help with student loan forgiveness? So that is a federal program. And so you would complete the paperwork for the federal, you would complete the paperwork to submit to the federal government. On there would be a space, I just had to do one this morning. And so on there would be a space for your employer to complete, and it basically says that you work for an agency that is accepted for that student loan forgiveness. So in essence, if you are employed with an agency that loan forgiveness applies to, then the answer would be yes, because your employer would just have to sign that you work here, if that answers your question. Let's see. And so Maggie asked, do you need a residency for that state in order to apply for the state government job? So you don't to apply. You don't need to live here to apply to the job. You should carefully see if the job is remote or on site. And people should say, because obviously if the job is on site, one would expect you to eventually move down here by your start date if you get hired. And like I said, if anyone wants to come down to sunny Florida, I have 4 job openings for epidemiologists coming up. So any advice on completing the exam portion that many government jobs have as part of the application process? So so Charlie, I'm not sure which, if you're talking about federal or other states. Currently, I mean, I can only give you my experience about Maryland and Florida. We don't have an exam. We don't have an exam portion on either of any of the state applications. What we do have, which you all should be mindful of and careful when applying for a state job or a government job, is there's generally a list of things called qualifying questions. And so essentially, if you don't, you have to answer truthfully, because you will attest at the bottom of the form that all of the answers are truthful. But if you don't answer yes generally to all of them, then the resumes generally get kicked out. So you should be careful about, you should carefully pay attention to what the qualifiers are, and if these are the minimum qualifications or the required qualifications, and whether or not you meet those. And I don't, Charlie, I don't know if you have, if there were other examples of the exam, but it's generally a series of questions. Like I'll give you an example about the advertisement that I was just going to post, that's going to be posted shortly for the jobs that I have. So the qualifying questions fall along the lines of, do you have a master's in public health or a related degree? Have you had at least 3 courses in epidemiology and 1 course in biostatistics? Are you willing to work after hours or during emergency duty? In Florida, if you're a state of Florida employee, you're required to. And so if you answer no to that, that's a non-starter. Another qualifying question is for one of my healthcare associated infections jobs is whether or not you have a bachelor's or master's in biology, because there's a lot of heavy biology backgrounds that would be useful and really, I think, necessary for a job like that. Any other questions?
If you don't want to type them in the chat, you can feel free to come off mute and ask your questions as well.
I don't know, Olivia or Paul, do you have any questions? Or anything you think I should clarify?
So I know that you definitely kind of spoke a lot to, working in the state government. Oh, sorry, Maddie, you should be able to have that function now to be able to unmute. You shared that you work in the state government, but it's also connected through Orange County. Can you share a little bit more about how that works and what that experience is like?
Sure. So it's complicated. So I mentioned that every state has its own structure for how they deliver public health services and the authorities. So in Florida, there we have the state, the Florida Department of Health, and I am a state employee, and I am essentially assigned or hired to the Florida Department of Health in Orange County, which is like a county office of the state health department. We are partly funded by the state, we're partly funded by federal funds, and we are partly funded by our county government. So Orange County government is actually a different entity that governs at the county level. We also have city level entities. like City of Orlando. It would be different than Baltimore City, because Baltimore City is its own jurisdiction, which is a city plus a county in the state of Maryland. So it's a little bit what I mean is it's that kind of structure is very specific to every state you work in. As far as how the interactions go, so essentially we are at the Florida Department of Health in Orange County. Our direction comes from the state health department. So we call it Tallahassee, or we call it state, or we call it up there. I don't know, local health departments are already down there, fairly or not. But we also have, so county government pays some of our existence. And so we also have to work closely with our Orange County mayor to make decisions about how we move forward for public health actions within our own county. And it's possible, and it happens, that county to county, there are variations because every other county here, while they have a Florida Department of Health in Lake County, Florida Department of Health in Seminole County, they are also partly funded by their county governments. And the Lake County mayor might decide to do something different than the Orange County mayor or the Seminole County mayor. And so every local health department has to work with their county administration to figure out what they're going to do together, while still somehow being consistent across the state with all of the state guidance. So I don't know if that clarifies things or not, but that's essentially where we are.
It did. It definitely did for me. There is another question in the chat asking about the prospects for international students on a visa.
Yeah, so it's not, so there's no, it's not barred, or it can be done. It's just that it's very specific to the program or the unit or the state that you want to apply to as to whether or not they are able to sponsor someone on a student visa. And so that would be you would have to really explore the fine details of that with the place that you're applying to, because it will vary from place to place.
Thank you. Maddie, if you want to go ahead and unmute and ask your question.
Thanks, Alvina. Thanks so much for being here today. Awesome presentation. It's great to hear from someone in state and local government. I think sometimes these voices are underrepresented in terms of like where people go after this master's. Wanted to hear about your experience with like the culture of both health departments you've worked at. Like, is it pretty collegial? Are people collaborative? Have you been able to find good mentorship, especially early on at MDH? Yeah, we'd just love to hear about the work culture.
I have had some phenomenal. My experience at the Maryland Department of Health is really, I think, shaped like who I am as a public health professional. So it really, I had some great mentors. My first mentor there, it was Dr. Kasani. She was the head of the Office of Preparedness and Response. She's currently at UNC. She's going to hate me for not forgetting which one, but she's at one of the UNCs, and I think it's Chapel Hill, but I'm not sure. It's either Chapel Hill or Raleigh. Anyway, she was a very strong woman, very, very strong personality, and a very strong leader. And so I think it was beneficial for me to have her as one of my first mentors. Also, the state epidemiologist who has been there, David, he was one of the former EIS fellows that I had mentioned from CDC. David is like my bellwether, like still for how public health should be practiced. Like to this day, if I'm in a conflict, I think to myself, what would David do? And then if I can do it, I try to do it. So yes, so I think it's actually it's a pretty small world, applied public health EPIs and EPIs that work in state health departments and local health departments. It's very small, and it's not a lot of people do it for that long of a time. You know, it's if you're in it, you're in it. So you had mentioned the voices are often unheard. It's because we work in the background. So, you know, if we did our jobs really well, you would never know because there wasn't that outbreak that got out of control. So a lot of us stuff happens in the background, and there's no, honestly, I tell people, I opened up to give you sort of like the harsh reality, but you don't get paid very much if you come here. But honestly, this is the only place where you can do the work that we're talking about. So if you want to work on outbreaks, if you want to control the pandemic, if you want to, if you want to be Kate Winslet, flying around the globe, chasing a pandemic, the public sector is the only place you can do that, and the only place you have authority to do that. So it's a small world. We hear about our colleagues. We know most of people working in other places. I had asked Olivia about some of the other presenters from today. It's likely I've heard of them or probably worked with them or know them. CST is very collegial. So I find that for epidemiologists working in this field, honestly, no one outside of this field really knows what you experience. It's a field unto itself. We're all in the same boat. So, and it's a place that's hard to describe to other people until you actually experience it. So I find it extremely supportive.
Thank you. I do have another question. So you spoke, of course, about, what it's like to work in state and local government. And then of course, what to do when you're job searching as far as looking for particular positions there. But could you share a little bit about what you might expect working as an epidemiologist?
Sure. As far as like day-to-day activities?
Yes,
or,
yes, the day in the life. What does that look like?
Day in the life. So as I pulled up the topics, I guess, that we had worked on our previous day. So a day in the life of it. So I'm biased, working in acute infectious diseases. So every morning, the epidemiologists, we go through the cases, reportable diseases. So in Florida, there's about 90 reportable diseases. They're required to be reported to the state health department via either fax or labs. When I worked in Maryland, we were still using fax machines. I believe they still use fax machines, which punch out paper. And those cases get entered in at the local level into an electronic disease surveillance system. And then if there's required follow-up, then there's case investigation. So let's just say, like right now, we're working on an outbreak of meningitis in the MSM community. And so lab for meningitis, so positive lab for Neisseria meningitidis comes through. We follow up with the hospital to review medical records. We follow up with the case patients to interview them about all of their exposures during the exposure window to try to identify where potentially might they have gotten infected. And then we follow up to find out who potentially they might have exposed, because for meninge, all of those people are recommended for antibiotic prophylaxis. And it's recommended you get it within 24 hours of finding out about the case. So there's an urgency there. And because one of the not uncommon sequelae is potentially very serious outcomes can come from a meninge infection, including death. So that is, say, the prioritization of the day. Like what fire do you need to put out like right now? Not to be hyperbolic about it, but so that someone doesn't die. So it's kind of like on the forefront of our minds, like every day, like what's going to come in and who are we going to keep from dying on that day? Or who do we keep from getting infected? Or if it's highly infectious, who do we keep from spreading, like becoming the next like typhoid Mary? So that part is a little bit, that's our purview. That's the public sector, the public health department's purview. So there's case investigation, medical records review, some data entry, as always. And we aren't government without some paper and some data entry. Let's see. So cases. We are currently working on, because we're still in the pandemic and we're still trying to distribute resources to different places, like like testing. Where do we send testing kits when we have a limited supply? Where do we send vaccines? Although they're seemingly unlimited supply, but we're trying to get into places with that are not well vaccinated, or places that are where the morbidity and mortality is high in our county. And so there's an epi working on GIS analysis of where are those health deserts or where are the health disparities the most. And then we work with our emergency operations people to send teams out to actually try to vaccinate or test more people in those places where there are health deserts. So I'm trying to think about my EPI's days. Like they call me throughout the day. So I'm trying to think of like the last couple of things they let me know about. So. I thought that's probably anyone else want to ask about what else we do in the day?
Well, there is a few other questions in the chat, and thank you for answering that, because I think that definitely kind of opens the door for what you might expect.
So Venus asks, what is the usual career trajectory for an epidemiologist in state and local government? So generally, I'll just lay it out there. So you would, let's say you're coming right out of grad school and you've got your master's. So you'd apply to something like an entry-level epidemiologist position. You'd probably be doing like the case investigations that I talked about and working on some outbreaks. And then usually there's some kind of track. So at the state of Maryland, I know they have 3 classifications that are epidemiologists, 1, 2, and 3. So 1 is entry level, 2 is usually 2 years of experience, and that's usually like an automatic kind of thing if you're around that long. And then 3 would be something like a lead epidemiologist where you direct the work of others or you have a team. Here in Florida, we have the same kind of track with not so many levels, which is government operations consultant 1, 2, and 3. And so 3 would be the lead, 1 would be say entry level. GOC 1 we have for bachelor's level, GOC 2 we have for master's level. And then after that is supervisory positions. Those can be a little bit hard to come by. Like I had mentioned, there has been a decrease since 2017 in the number of positions that public health agencies have been granted. The funding decreases and thus they decrease positions is kind of how that goes. From a really practical perspective, like from a manager's perspective, I get a lot of really good young people who come to public health for a couple of years. They do great, and then the call of private sector, the siren call of private sector and a higher salary calls to them, for whatever circumstances they have. Maybe you want to move or start a family and you need an increase in salary, and government isn't that competitive. So I lose a lot of people after the entry level phase. But if you're going to stick it out after a couple of years, then that potential for I guess manager positions is available. And it's specific, like I mentioned, it's specific to the state that you're in or the structure that you're starting with. So there's a lot of people who go local to state to federal, like they start at a local health department, they go to the state health department, and then they go to CDC. There are some people that go in the opposite direction, So I hope that helps, Venus. And then Sarah. So Sarah says she always thought starting in outbreak investigation and control work meant starting off as a contact tracer. So the fellowship, so starting off as a contact tracing is sort of like that's a unique thing to what's happening like right now. As I mentioned, with a lot of resources being given or distributed to local and state governments for control of the pandemic, because of the pandemic response, that's where there happens to be all the jobs like right now. So in the context that you're in, there's a lot of open contact tracer jobs, and those are a little bit easy to get. But they're also contractual, but they are a foot in the door. So if you wanted to start in a state that has contact tracer jobs, that is a foot in the door, and that is in most places under the management of an epidemiology program. So currently, I know in both Maryland and Florida, COVID-19 contact tracing is they're both under the purview of the epidemiology programs. And so those are those are foots in the door. I will tell you that I have hired 7 contact tracers into like normal health department positions, because I've seen how they work, and you know, they seem like they would be a good fit. So let's see, other fellowships epi-related in California. And so the like things like the CST program or the EIS, the CDC EIS, they have them in every state. Most of them in every state. One of the really great features of those programs, which goes back to someone else's question about mentorship. I think it was Maggie maybe. Is that in order to be placed into a fellowship program like that, there has to be an alumni to mentor you, and you are assigned to that alumni. And so that is one of the great things. But the state, that person has to agree to do it, plus have the funding for it. And so you would have to specifically look. You can look at the CST program and the EIS program and see what states are available. And then you can also look at, Florida has its own EIS fellowship inside the state of Florida. So California might have something similar. Okay. I think we're coming up to the hour, so.
We are. I don't see any other questions here, but thank you for answering the ones that were shared. Did you have any final thoughts that you want to leave with everyone?
I did, you know, it's just sort of a summation about, I know I started off a little doom and gloom, but about the reality of the landscape, the workforce landscape for public sector epidemiologists. But I did want to end with the dedication of the workforce that's in it. And so, you know, there's no glory or money in working at a state or local health department, but the work is why we're here, and it's extremely rewarding.
Thank you. Thank you so much for that. And for presenting today. We thank you all for participating in this presentation and for the questions that you've asked. Please do join us for our next session, which will be starting at 2 p.m. We'll hear from Shauna Dale about networking. And then also you'll be getting a follow-up email at the end of today with additional information from Alvina's presentation. Thank you again.
Thank you. Thank you so much for having me. And you have my contact information, so reach out if you'd like.
Okay.
Bye, thank you.
Thank you.
Bye, everyone. Have a good day.